New research shows gambling in this country is shifting from a recreational pastime to a growing public health concern. And when it comes to our mental health, the stakes are high. Joining me now to help break down the relationship between gambling and mental health is Michael Cooper with Mental Health Research Canada. Michael, good to speak with you.
Thank you so much for having me.
Before we get to the impact gambling has on our mental health, can you just give us an idea of how prevalent gambling is here in Canada?
Well, our research has shown it's about 9% of Canadians are showing problematic gambling on a scale that's been used for quite some time called the PGSI, and that is highly concentrated among younger Canadians, 18 to 34, and males.
So when we're talking about problem gambling, how does it impact our mental health?
Well, the most recent research we've put out has shown that for individuals who are showing high on the PGSI or problematic gamblers, they're about 8 times more likely to plan a suicide, 4 times more likely to show up as severe on what's called the GAD-7 or an anxiety screener. They're about 4 times as likely to show up as severe on a depression screener, and they're about 3.5 times as likely to have just thought about a suicide as well. So when you put that forward, you can see that that's more likely to indicate likely attempts on suicide, and there are other significant harms, including spending more than they can afford and having a cascading effect on their family as well, too.
You know, as I was reading through the research just released, it really stood out that the thing about gambling and its effect on your mental health is it doesn't have to be a problem gambling issue to have some repercussions.
Yeah, so there are really 4 classifications. So we know that about 75% of Canadians participate in some form of gambling. And for the majority, and that includes things like lottery, horse racing, going to a casino. The most common form of what we would consider gambling is lottery. But what we find is that there's a significant disconnect. There's almost no problematic gamblers who are doing just lottery. So this is considered a relatively safe activity, so it's not dramatically impacting your mental health. But what we do find is when you start moving especially into online forms of gambling, we do find that approximately 40% of people who are participating in an online form of gambling, sports betting, or there's a host of different online gambling from loot boxes to online casinos, about 40% of them are actually showing problematic gambling indicators. And that's where we see these incredible spikes in negative mental health.
You know, speaking of online gambling, there's been a big push as of late to ban sports gambling ads as they're seen as being quite aggressive. How much blame do you think falls on these types of ads in terms of what we're seeing in gambling behavior?
So, I wouldn't really think about it in terms of blame. We do have other indicators and research that has not come out yet, which actually looks at the effectiveness of this ads, and it is correlated that, the more effective these ads are, the more likely you are to become a problematic gambler, which isn't surprising. I mean, the very fact that approximately 1 in 5 ads that people are seeing during sports games are based around gambling suggests that these companies know that they're working. Otherwise, they wouldn't be putting in so much money into these ads. We can also see it in the amount of revenue that's being generated here in Ontario, for example, where a lot of these ads are being generated from. We're seeing that the rates of revenue coming in from gambling has gone up by about 300% in the last 3 years.
Are there enough resources available for people to get help if they think they do have a problem?
I don't think so. There is not as many resources that are available for problematic gamblers as a lot of this change has happened since the law shifted in 2021. So we haven't really seen the degree of supports that need to be available based on the scale of this need, simply because it is so new. So while there are helplines and there are supports available, we don't have a national strategy here in Canada, which basically means we're not investing in these sorts of supports at scale for the scale of the issue that's coming down the pipe.
Well, hopefully the research like you're sharing with us tonight will help lead some of those discussions. Michael, thanks so much for your time.
My pleasure.